All right. Good morning. Welcome to our weekly COVID briefing for the state's COVID-19 response. My name is Joe Doherty. I'm with the Utah Department of Public Safety. Today, our speakers include Governor Cox, Lieutenant Governor Henderson, and Dr. Dunn. I'm going to jump the gun here. This is going to be Dr. Dunn's last briefing with us, so we're all a little bit sad. We'll be missing her when she moves to pastures, but you'll get to hear from her in a minute here. So, Governor Cox.
Ladies and gentlemen, it's great to be with you again. I don't know about greener pastures, Joe, but we are going to miss Dr. Dunn. For those of you that are wondering, I am a little underdressed today, but I do have my I Love Dr. Dunn t-shirt on. So we wanted to make sure that we took a second to pay tribute to her, and I'll do that in a minute. But I want to talk about a couple things today. This will be just kind of a routine update as things continue to improve. We, as all of you know, we met the metrics of what has affectionately been known as the Endgame Bill, HB 294, and we met them a little earlier than anticipated. And all of that is great news for the people of the state of Utah. It means that our case counts are down. It means that our hospitalizations and our ICU specifically utilization is down, and most importantly, it means that our vaccination numbers continue to grow and vaccine availability continues to grow as well. So with that, as has been widely reported, the end of that, almost all restrictions, what very little were left, are now gone. The only exception being that just until the end of the school year, just a couple more weeks left, that we do still have a mask requirement and a test to play requirement for our schools. And so we will be finishing out the school year, and then those will go away as well. We get asked all the time, if there are, if there aren't any restrictions, does that mean that we can go back to theaters and that we can go back to large-scale sporting events? And the answer is yes. There are no restrictions on state restrictions on any of those events or those opportunities. Now, what this means, though, is that it is a transition to people and to institutions to make choices that they believe are necessary to keep their employees and their patrons safe, and they will continue to do that. And so, of course, many of our businesses will still have some of those restrictions in place. They will be loosening those as case counts continue to go down, and we encourage, more than anything, it is now really about personal responsibility. People need to exercise caution, especially those that are not vaccinated or who are at high risk. And so we sure appreciate the measured approach that so many people have taken to help us get back to normal. And I am excited. I know Dr. Dunn will talk about the numbers. We've mentioned that we've been in a plateau now for a few weeks, that we avoided the surges that we're seeing in many other states, but being in a plateau, and this past week we have seen numbers start to drop again precipitously. I haven't run the numbers, but somewhere north of a 10% drop over this past week, which is just great news, and it's nice to see those numbers coming back down again. But the reason that is happening is because of our vaccination efforts. We have our updated numbers. Over 2.2 million doses have been administered. That's a daily increase of about 17,760 doses since just yesterday. Around 56% of all eligible people in Utah have gotten at least one dose, and we expect that number to continue to rise. Tomorrow, we expect to reach an incredible milestone that we will have more than 1 million Utahns fully vaccinated. Of course, course, we had passed the 1 million threshold quite a while ago with the first dose, but to have 1 million Utahns fully vaccinated, I know many of us didn't expect to see that day, especially this early in May, but we appreciate Utahns who have stepped up and gotten those vaccines. As we mentioned last week, we've reached the point where there are enough vaccines in the state to get any eligible person vaccinated. Because of this, many of our largest vaccine providers have stopped requiring appointments, so there's no excuse to find someone near you with that has vaccines available. Some of our smaller providers, however, like local pharmacies, may still require an appointment, so please check with your local providers and find the one that's closest and easiest for you. Now, there is another resource available to find out where you can get vaccines. The federal government just announced this week that you can now find vaccines via text message in English or Spanish. If you text your zip code to GetVax, which is 438-829, you will receive a reply with 3 vaccination locations near you. So again, if you just text your zip code to the number GetVax, which is 438-829, you will then receive 3 different locations nearest you. And I'll share that in Spanish as well. En español, si envía un mensaje de texto con su código postal a vacuna 822-862, recibirá una respuesta con 3 sitios cercanos para recibir vacuna de COVID-19. Okay. Now, the transmission index is no longer a requirement, but just for your information, I'll share these right now. We are fortunate to be at our lowest 7-day average for cases since June. On June 14th of last year, our average case count was 340. Today, our average case count is at 343. So just remarkable to be there. The transmission index still exists as a guide, and you can find that county by county index on our website at coronavirus.utah.gov. We will continue to update that, but just for information purposes, we have 3 counties that moved from low to moderate. That's Duchesne, Morgan, and San Juan, and 2 counties have moved from moderate to low. So we had a couple counties just switch places, and that is Uinta and Washington. So we have just 1 county in high, we have 13 in moderate, and we have 15 in low transmission. The last thing I want to say, and then we'll turn it over to Lieutenant Governor Henderson, and then Dr. Dunn. Actually, 2 things I want to say very quickly. One is just to say, look, we understand that there are some people with differences of opinion when it comes to COVID-19 and those restrictions. We've had this discussion many times. My request once again is just to show some empathy, some kindness, show some grace for people who see things differently than you. There's no right way to come out of a pandemic. Everybody is doing this at different speeds. We're working through this as quickly at the state level as possible, which is why I'm very proud of our state and the legislature and others who have worked to remove those restrictions. But for those restrictions that still remain in place, again, please show kindness, please show some humanity and some grace when dealing with people who see things a little differently. Now, the last thing I do want to say, and this is just about Dr. Dunn. At different times in our lives, we all go through hard things. Everybody in their life can think back to a time when they've gone through something very difficult, whether at work or in their personal lives, in their family lives. And there are people that go through that with you or that you're close to. And those relationships and those experiences really kind of bind us together. And I've said all along, you learn a lot about a person when in the worst of times, when there's an emergency. And over the course of the past year plus, in fact, my relationship and my friendship with Dr. Dunn started way before this. It's unfortunate that people in Utah only got to know her because of the pandemic, because the work that she was doing for the state of Utah before that was absolutely critical. I first engaged with Dr. Dunn working on opioid addictions in our state and helping with the opioid crisis, and she was just as brilliant there as she has been through the pandemic. And to have Dr. Dunn, who, by the way, is also just representative of all of the incredible public health workers that we have in our state and the medical profession who have worked tirelessly over the past year plus to lead us to where we are. But the going through this fire and seeing the way that she handled the burden of this crisis, as well as the criticism that was never deserved and never expected in a job like hers. She didn't run for office. She's simply here to help us keep the public safe, and she's done that at every turn at much sacrifice to her and to her family. And so I just want her to know, on behalf of me personally, on behalf of our team, our staff, on behalf of my family, and on behalf of the 3.3 million people of the state of Utah, I just want her to know how grateful we are for everything that she has done over the past year. We've been so fortunate to have her leadership and her guidance, and we will miss her dearly, but we're excited for this next chapter, this next adventure, as she moves over to Salt Lake County Public Health. She'll do a tremendous job there. You're getting one of the best, and we'll continue to work together in that capacity. So on that somber note, as I hold it all together, we're going to turn the microphone over to Lieutenant Governor Henderson for an update on some of our vaccination efforts. Lieutenant Governor.
Thank you, Governor. Good morning, everybody. It's wonderful to be here. I'm really excited and hopeful today as our efforts that have been underway for a long time seem to be paying off, and not just the efforts on behalf of state officials and public health workers, but every Utahn has put forward a lot of effort over the past year plus to do their part, to get the pandemic under control, to make sure that people are protected and safe, and that their loved ones, family members, neighbors, and friends can survive the pandemic. We've lost a lot of people, and there are a lot of people still suffering. But we're in a really hopeful place, and I'm very excited about that. I wish I had a Dr. Dunn shirt, and I love Dr. I feel a little bit left out that I don't have one of those. Maybe at some point I can get one, because I am also a huge fan of Dr. Dunn and love her and what she's done. This whole vaccination effort has been an evolutionary process. We've adapted, we've changed, we've switched strategies as we've seen fit, and as changes are made, and as we've seen things that need to change, we have done so. So one of the big changes that we are making now, as the governor mentioned last week in his press conferences, we still have mass vaccination sites, but we are now switching from expecting everybody to come to us to us coming to you. And that's something that we're really excited about as we increase the number of people in the state who become vaccinated. And we still really want to get those people who haven't yet gotten it but would get it and want to get vaccinated. We want to make things easier for them. So we're going to bring the vaccine to you. We're sending out mobile clinics across the state to community groups, to businesses, to places of worship, really any group who wants to have a mobile vaccine clinic come to them at no cost to them. The state will provide that. To request one of these events, vaccine events for your organization, go to coronavirus.utah.gov and click on Request a Vaccine Event near the top of the page. Now, since we announced this new program last week, we've had over 200 requests come in from groups around the state, and those 200 requests total over 27,000 doses of vaccine that have been requested. So we're really excited about that. We know that going to a large clinic is not accessible or practical for everybody. And we saw this early on, which is why we really did start focusing on vaccine equity. And equity means a lot of different things. We want our vaccination rates to reflect our population. We also want to make sure that people who have a hard time getting vaccinated but that want to get vaccinated can get a shot. So just a quick update on our vaccine equity with some of the minority populations that we do track. As of today, 41% of Asian adults have received at least one dose of the vaccine. 34% of Hispanic adults have. 23% of Black adults and 23% of our Native Hawaiian Pacific Islander community, the adults in those communities, have received at least one dose of vaccine. Now, to put this into perspective, at least 50% of white adults have received at least one dose of vaccine. So we are making progress, but we still have work to do. We want those rates really to be the same across the communities in our state. We want people to make sure they do have access, and we're continuing to work on that. 87% of people 65 and older have received at least one dose, and 76% of this population are fully vaccinated, and we are just so incredibly grateful for that. So on that note, I do want to express my gratitude for Dr. Dunn. She's just incredible, and I've been very fortunate to be able to get to know her a little bit over the past few months and work with her. She has saved lives. The work that she has done for our state has saved many lives, and we're very, very thankful for that and grateful to her and wish her the very best in her future endeavors. Thank you.
Okay. Good morning. Thank you, Governor Cox and Lieutenant Governor Henderson, for the really kind words. We'll get started with the numbers. So good news today, which is fantastic. Our rolling 7-day average of new cases is now down to 343. This is a huge decrease. Last week we were at 380. And our percent positivity has pretty much remained the same, with person over person being 6.7%. Last week it was 6.5%. And test over test is remaining steady at 3.5%. And our cases are decreasing in Utah, but also nationally, which is a great sign. And the more we continue to vaccinate individuals, the faster this drop will happen. 56% of all eligible Utahns have received at least one dose of the vaccine, and 42% of all Utahns have received one dose of the vaccine. And this number is just going to continue to increase, especially with the Pfizer vaccine becoming available soon for 12 to 15-year-olds. We anticipate this will happen as early as next week. And this is fantastic for Utah. We have about 215,000 Utahns that are age 12 to 15 years old. And this age group, in part, is contributing to the COVID spread right now. So having 12 to 15-year-olds get vaccinated will really cause our cases to just plummet. And of course, it's going to protect them as individuals, but it's also going to allow our extracurricular activities to continue safely. And in the fall, it's going to help schools be a safe place for students and teachers. So as soon as the FDA and CDC approve the Pfizer vaccine for 12 to 15-year-olds, make an appointment for your child. And if you have questions, contact your healthcare provider to talk about those. This is the most important next step we can do as a state to end this pandemic. And I do just want to say, since this is my last press conference, thank you. Thank you to the state of Utah, to my Utah Department of Health family, of course, the media, and all the Utahns out there who have been such a great support over the past 14 months.
Okay, thank you, Dr. Dunn. And with that, we'll open it to questions.
Yeah, hi. Paul Nelson from KSL News Radio. First of all, Dr. Dunn, I think I speak for all of us reporters that it has been an absolute pleasure. Thank you very much. I guess the next question is, with the cases going down and with the vaccine coming out for young kids or younger teens, are we kind of on cruise control, or is there still something that can go very, very wrong?
Say that last part again, Paul.
kind of on cruise control now that the vaccine's going to be available for, say, younger teens? Or is there still something that could go very, very wrong and make the spread even worse?
Sure. So look, again, the virus is going to do what the virus does, and the virus is just looking for hosts to replicate. The fewer hosts that are available where it can do that, and the variants as well, then the harder it is to do that. And so the good news is, again, we had this conversation just yesterday with our unified command team, and we've been watching closely. There are a couple countries that are ahead of us in vaccinations, and really the two are Great Britain and Israel, and especially Israel. Israel's been the best country in the world when it comes to vaccinations. And if you look at the numbers there, speaking of cruise control, I mean, their numbers are so low. I mean, the lowest they've seen since the very, very first days of the pandemic. And so that's where we're definitely headed. And sure, with new variants, there are lots of things that could potentially happen. But as more and more people get vaccinated, and as more and more people have already had the disease, the combination of those two things makes it harder for the disease to find a host. So, we never say never. You don't declare victory until we get to the end of this thing. But I think we all feel pretty good about things. Dr. Dunn, would you like to add to that, please?
Yeah, I mean, I agree with everything the governor said. Of course, over the past 14 months, the one thing we've learned is that the virus will keep us on our toes. And so the thing we're looking at, of course, are variants that specifically aren't susceptible to the vaccine, but there's no sign of that right now. And the quicker we get people vaccinated, the more we are able to prevent that from happening. And we're in a really, really good spot. So continuing on is the message right now.
Hi, Governor Cox. This is Sophia Eppolito with the AP. I wanted to ask about, we've seen, our numbers are going down, our vaccination numbers are going up, but we're still seeing quite a lot of vaccine misinformation going around. Over the weekend, there was a burning of a huge syringe that hundreds of people attended. I'm curious what message you would send to people who are still so staunchly anti-vaccine, and what is being done to combat this misinformation and better educate folks?
Sure, thank you. So we're constantly working. I want to thank our comms team, our communications teams, our public relations teams, who have, again, through the virus, they're the people you don't get to see very often, but they have been working just as hard as everyone else. This has been a constant battle throughout this, not just with vaccines, with the virus itself, with testing, with masks. It's always there are always people out there who are sharing bad information, who are bad actors, who are purposely trying to sow division, and people who are just skeptical. And so my message is just this, and it was Dr. Dunn's message as well. If you have questions or concerns, Facebook is not the place to get those answers, but your doctor is. And so we would encourage you to reach out to your healthcare provider to have those conversations and those questions. We are constantly working to update and give out the best information and try to help people overcome that hesitancy. Now look, there are people who will never get the vaccine, and we understand that, and we're not going to make them get the vaccine. But there are a lot of people who are rightly curious and trying to get good information, and we would encourage you to go to the right sources to get that information. Again, your healthcare provider being the best one. You can go to coronavirus.utah.gov to get more information. We're also working with the federal government on their messaging campaigns, finding trusted voices. You'll see more from us. We've done a lot of this already, but in the coming days, you'll see additional ads that we'll be putting out, additional social media pieces that we're putting out, from trusted voices in different communities that can speak to those issues. We're also doing a lot of survey work, and this has been true throughout the pandemic, but we ask every week, we're doing survey work and asking people, are you willing to get the vaccine? If not, why? Who would you listen to? Who are the people that you trust to get your information? And then again, trying to get those voices in front of people. So we have lots of moving pieces on the public relations campaign, and we'll be doing right now. Though we're not to the point where vaccine hesitancy is the problem, and I think I mentioned this last week. There's still a lot of people that are willing to get the vaccine, they just haven't gotten it yet, and it's mostly a matter of convenience for them. And so all of the things that the Lieutenant Governor mentioned are really important as we work to remove those barriers to make it as easy as possible. That's our real focus right now, are the people who are willing to get it but just haven't gotten it yet.
Yeah, hi, this is Haley Hendricks with ABC4 News. First, I would like to say thank you to Dr. Dunn for your work and service to Utahns during this pandemic. And then this question is for Dr. Dunn and Governor Cox as well. The last 14 months have been long for all of us. What is it like to see the state meet all of these metrics for House Bill 294? And then within this time, there's been a lot of changes. What's the successes and even things you would have maybe done differently earlier in the pandemic's response?
I'm wishing that I wouldn't have come up here first. But so I think there's definitely some apprehension about meeting those metrics and suddenly having, the public health orders go away. But I think what we're showing in the numbers is that things are going well, with cases going down and vaccines going up. And really that's what we need to be doing right now is getting more people vaccinated. That's really our ticket out of this. Gosh, about what we've done good and bad over the past 14 months, that's probably longer than, a press conference answer. There are definitely lessons learned, but I will say the best thing that we've done as a state is remain flexible and nimble. So when we got new information, we acted on it quickly, and we were able to change course based on that new information to save lives in this state. And we're fortunate to be in a state that was able to do that.
Thank you.
And I would just concur with what Dr. Dunn said. I think that I remember talking, back in January and February about how we felt we could get enough vaccine here and get more people vaccinated quickly, and changing some of the metrics and changing who we were going to vaccinate, focusing on our most vulnerable population, and putting some very serious goals out there, and driving to meet that, and that's so to me, getting to the end of some of these metrics and these requirements, I'm incredibly excited. I'm incredibly relieved. I'm glad that in her last week we were able to see case counts come down again, so we could leave on a really positive note. And but seeing the death counts come down, I mean that to me is the best part of all. It means fewer people are dying of this virus. Now, when we look back, and I'm sure there will be lots of postmortems written on states and the federal responses. I said all along, one of the things I wish we had done differently was testing. I wish the federal government had put more emphasis on testing. I think that's one of the areas where the ball was dropped significantly. If they had treated testing the way they had treated vaccines, I think we would have lost many fewer Americans. But we are here today. And we're here because so many people, and the people of Utah, more importantly, have worked hard to prevent deaths and save lives. I think we have the 6th lowest mortality rate in the country, and our economy is doing really well. So if you look at, if this had played out 100 times, differently, I think that there are a few scenarios where it could have gone better, but there are many scenarios where it could have gone a lot worse for the state of Utah. And I think we all feel a sense of relief to be where we are today. Okay, we'll get one more. Okay, yeah. Well, let's do one more.
Hi, Governor. It's Lisa Roche. I'm wondering if you could tell us about your reaction to those parents in the Granite School District who disrupted a meeting over children wearing masks. I know you talked about treating people with kindness and empathy and all that going forward, but we're seeing some pretty harsh reactions, and I'm wondering what your reaction to that specific event was, and what's your message to keep that from happening in other ways in the state as we encounter people who may not feel comfortable going out without wearing masks, or people that are upset when they see people wearing masks. Can you talk about that, please?
Sure. Yeah. Thank you, Lisa. Look, again, the worst of times often brings out the best in people, but sometimes it brings out the worst in people. And I know that everyone is reacting differently to the difficulties of this. And I don't know those people personally. I don't know what's happened in their lives that have led them to a point where they would ever feel like that type of behavior is okay. It's been remarkable during this pandemic. We've seen kids act like adults, and unfortunately, there's been a few cases where we've seen adults act like kids, and that's unfortunate. But look, again, I always hate that we give so much attention to the people who deserve it the least. And that's certainly the case here. And so it's, people can embarrass themselves. They can do those types of things. But by and large, again, Utahns have been really, really good through this pandemic. And I want to focus on all the good that has been done over the past year, because most of it we'll never know. Most people will never see the kindness, the people who sacrificed for others, to lift others, people who were struggling with food insecurity, people who were struggling with health, people who lost loved ones. Again, we can't ever forget that over 2,000 Utahns are not alive today because of this terrible pandemic. But I just choose to focus on the good news of the day and the good people that are doing it. Again, and to those that are worried about those mask requirements, they'll be gone in a couple weeks, and so just hang on there. We're at the end. Let's end this the right way, and let's go forward and have a positive interactions with each other. And with that. That's our time for today. We appreciate, we have to steal Dr. Dunn away with us, so she won't be available for extra questions today, but we need to go and send her off in the appropriate way. So again, thank you to our media partners for this. We'll see you again next week, but not with Dr. Dunn. So take care, everyone.